Hello and welcome to On Call After Hours, where we answer the questions we weren't able to get to during the broadcast portion of our show. All of your questions are important to us, and we want to answer as many as we can for you, so let's roll into it. 71-year-old woman from Volga, what do the doctors know about LifeVantage brand Protandim, a supplement and NRF2 synergizer said to reduce oxidative stress? What do you know, Jim?
Boy, I'm not familiar with that one.
That one's new to you. What do you know of that, Vanina?
No, I don't. I mean, so it sounds like it's another antioxidant. So again, I would be very, very careful with that.
Yeah. Heavy on the marketing, low on the science.
Yeah.
I mean, they've got when you see a lot of fancy, whoa, we do this, and they add oxidative stress, you know they're pulling a line. I've got a question. What is the value of St. John's wort? Jim?
St. John's wort is most commonly used for people with depression, and we have to really be careful there because there is evidence that it works in mild depression, but not moderate or severe. But my biggest thing with depression is depression's not a self-treatable disease, and they really need to seek appropriate help for any type of depression, mild, moderate, or severe. Right. And so there is some efficacy there, but again, really important to seek professional help when it comes to any type of mental illness, and depression especially. Yes. And the other side of St. John's wort, it's probably one of the most notorious for drug-drug interactions.
So it messes up a lot of other things.
It can really wreak a lot of havoc with your medication regimen. So,
particularly antidepressants.
Yeah, antidepressants and even some, anticoagulation and things like that as well. So,
Vanina, you have any comment about St. John's wort?
Yeah, again, really is only effective in mild depression, and we worry about it. It can affect the liver enzymes and how we break down all kinds of medication. I mean, everything you can think of interacts with St. John's wort. If the patient is under the care of a physician and that's the only medication that they're on, that may be safe. But again, just like Jim said, being under the care of a physician, I think is very important. The other thing is what I see a lot is people who are already on antidepressants and then they add St. John's wort without telling their physician. And actually there you really can get in trouble because you can get very high levels of serotonin. So it's appropriate in the right setting, but does have a lot of medication interactions in the liver.
88-year-old woman from Sioux Falls, what other kind of painkiller can she use besides morphine? Are there any supplements that are useful for pain? Jim?
Well, supplements for pain, again, pain management is a whole other topic, right? But really, if you're under treatment with morphine, I mean, you're obviously using some very strong
heavy pain
analgesics for your pain. And so really, I don't think anything that's a supplement level type of a drug is really probably going to add on to that. Now,
to replace the morphine.
Now, there are some over-the-counter things we know that, for example, Tylenol or acetaminophen can augment opioids for morphine for pain control if it's a certain type, and non-steroidals like ibuprofen and stuff like that can help with bone pain and such, and can augment analgesics. But really, the supplement world really, in my opinion, would not really offer much to.
And it's interesting that toxicity of morphine, you can go to, if you have to go higher doses, is there, but there's toxicity of Tylenol or acetaminophen too, and you don't want to go more than 3 grams of acetaminophen a day.
Yeah. I think the one thing I would vote for is if the chronic pain is from arthritis or joint pains. I think that fish oil is a reasonable thing to try. Again, it's not going to be as strong as morphine, but I think it would be good to help lubricate joints. I mean, there's no studies, again, that show that it treats arthritis, but I think it's a reasonable supplement. You would want to make sure that your vitamin D levels are high enough. Some people with mild arthritis can respond to capsaicin, which is, the
Pepper.
component that's in chili peppers. So these are more natural options. Whether they can substitute for morphine is unclear. But there's other, again, for joint pains, there's things like Tai Chi and other alternative physical kinds of exercise that are helpful. And so I'd encourage you to think about those.
Right, the capsaicin, which is interesting, is a hot pepper cream. It's a cream, it's topical, and you rub it on the joint. But you've got to be careful after you've rubbed it on the joint that you don't rub it in your eyes, and then
Right,
suddenly
right,
your
yeah.
eyes are inflamed. 89-year-old woman from Rapid City, please discuss omega XL fatty acids. Are they safe and beneficial? Jim.
Well, I think
Oh, Vandana.
Go ahead.
Yeah, she's referring, I think, to omega-3 fatty acids,
Yeah.
which I think are beneficial. There used to be a lot of studies in the last couple of years that showed that they were very beneficial to the heart. I think those are not quite as clear-cut as we had hoped or thought. And again, they do thin the blood slightly, so it's very important that your doctor know that you're on these medications, or if you're going for surgery, it's very important that that the surgery team and the doctors know that you're on that medication. But in the right setting, it can help heart, especially people who have heart disease or have had a heart attack. I would check with your physician to see if that's reasonable, but I do think that there's some benefit to that.
I remember the original studies that threw everybody into this was from Denmark, and they looked at fishermen or men from Denmark, and the people who were eating a lot of fish had less heart disease than the people who weren't. And so then they thought, well, what is it in fish? And then they tried to separate it, and they found that it's the fish. It's not not always the fish oil, but it's the fish. That's the better deal.
Yeah, and the fish oils, they have been shown to have a modest effect on lowering LDL cholesterol and lowering triglycerides and lowering total cholesterol.
And it might well be just the vitamin D that's in there. Remember cod liver oil? I mean, that's what it is. It's fish oil, right? Yeah. Cod liver oil
But
didn't go away.
I think the one place where we know the fish oil is beneficial is to lower triglycerides. So there, I think it's pretty clear cut. As long as your physician knows and is following your triglycerides, following your liver tests, I think there it really is beneficial. And studies I think about are the ones, again, just like the Danish studies, they're like the island of Crete, where, again, people who are fishing and fishermen from the island of Crete who had very low heart disease, and it's probably because of the fish.
It's the fish.
And again, the best thing is to have fish 3 times a week.
Yeah, it's the fish. Or maybe it's the vitamin, the iodine. Who knows? I mean, but think about the powerhouse countries of the world that really dominated for many years, and it was England and Japan. And they're just surrounded, eating a lot of fish. I think, there might be something that we can glean from that. 73-year-old woman from Sioux Falls, vitamin D3 on the bottle. It says it contains cholecalciferol, something that's used in Newfoundland as a pesticide to remove possums. PDA research says the problem is dose-related. A little bit is damaging to possums. Have you ever heard that? Vitamin D is damaging to possums.
I don't think I've heard that.
had not.
Cholecalciferol is the type of vitamin D, and there's vitamin D2 and there's vitamin D3. Vitamin D3 is better absorbed. Again, you have to be careful with the dose and and how much you're getting in your diet. But gosh, I have not heard them tested in possums.
66-year-old woman from Huron has krill oil been proven to prevent coronary heart disease. Jim?
Krill oil.
That's another kind of a fish oil kind of a deal,
Yeah,
krill.
I'm not familiar with the evidence on krill oil.
I don't think there's a lot. People use krill oil, especially vegetarians who don't want to have any kind of meat or fish in their diet. Krill is sort of
Pre-fish.
right. So I think a lot of people use it for that reason, and I think theoretically it should be beneficial because it does. Fish eat it, and it may be where the omega-3 fatty acids start, but there aren't actually any studies or any large-scale studies that suggest that it's as effective as fish oil.
Yeah, so the krill live on the surface of the ocean and they get all the sun, and then as they die off, they kind of settle and then the fish on the deep, dark bottom where they never get any sun, they eat the krill that had the sun, and then they store it. And whales eat krill, and mares eat oats, and little lambs eat ivy. 66-year-old woman from Huron, no, that's it. 73-year-old woman from Yankton takes omeprazole for reflux. Some omeprazole has magnesium and some doesn't. Which is better, and is there a benefit, and is there a danger from the omeprazole? What do you know about that, Vanina?
The only thing I worry with omeprazole, so obviously it's very effective, especially if you've had a peptic ulcer or bleeding ulcer. So presumably the person needs it for some reason, so it is beneficial. Remember though, when you're stopping stomach acid, you're not absorbing as much vitamin B12. So you want to make sure that you're getting vitamin B12 in your diet, and you still may not absorb it because, again, it requires an acidic environment to absorb it. The magnesium, I haven't really heard whether it's beneficial or not beneficial. My suspicion is that the doses are probably small enough that it's not going to make a difference. If the patient has kidney problems, then it's probably not a good idea. But I don't think that there would be one that would be better than the other.
The omeprazole is one of the most life-changing things that's happened in medicine in 30 years ago, 20 years ago when it was developed. All these people who had miserable stomachs, it made a huge difference. It's Prilosec, and it's Nexium because that's just one side of the omeprazole. It's right-sided omeprazole or left side, I can't remember, whichever. You have any take on omeprazole and the side effects, Jim?
Yeah, omeprazole side effects, it can decrease your magnesium levels, actually decrease your magnesium absorption. So I think that's one of the reasons we see the magnesium there. It can also affect, in addition to the vitamin B she was talking about, calcium. So you can see an effect on calcium too.
They don't get enough calcium because they're not absorbing it.
It can decrease your calcium absorption, which can then lead to other problems as well. So, it's one of those things, as was said, when you change one function of the body, it has sort of a domino effect. So it's really one you want to try to stay away from taking chronically.
Unless you have to.
Unless you have to.
And but there is also this, it lowers your acidity in your stomach, and then there's more aspiration pneumonias, I've heard, as a result of that. Well, I can't tell you how much I appreciate both of you for being on the show and after hours and joining us and giving us your time and your expertise. And it's good to see you again, Vanina, after
nice to see you again, Rick.
5 years, or what was it?
It's been that long.
Yeah, 4 years ago or something like that in Boston. So wonderful. Thank you both so much for joining us.
It was a pleasure.
And thank you for joining us on our website. We appreciate all of your questions and the opportunity to answer them. And so until next time.